It's important to have a way of dealing with suicidal thoughts. Suicidal thoughts actually are not that uncommon. I would say about 1 in 3 therapy clients presenting to a psychology practice with distress would experience suicidal thoughts at some stage. After all, if we were experiencing severe or ongoing stress that we thought wasn't going to get better, then it would seem like life wasn't worth living. However, the problem with severe and ongoing distress, especially with the changes in brain chemistry that can go with that, is that it distorts our thinking. We develop more negative thoughts about ourselves, about things that happen, and about the future. So the biggest problem with suicidal thoughts is if we become isolated with our thinking. If we become isolated with them owing to feelings of shame or embarrassment or maybe feelings of failure, it's very important to reach out. Because if you reach out and let someone know, someone trusted like a family member, preferably a GP or a health professional or a mental health professional as well, then it can do a number of things. Typically, it reduces the feelings of shame and leads to feelings of relief from having let someone know. It mobilises supports and helps get a different perspective in the situation. I know something what it's like about having suicidal thoughts myself, having gone through 2 serious bouts of suicidality in my early adult life, lasting for months. And at the time, even though I'd been an experienced psychologist the second time for 10 years, I felt that I knew I would never get better. That's how distorted my thoughts were. Because I'd seen for the last 10 years, the vast majority of people with depression and very serious psychological difficulties tend to get back to their normal self. Usually, people recover fully. But I lost perspective of that, even though I knew that background. So it's very important to reach out and let someone know. It is most likely you will fully recover even from severe depression that goes on for a period of time, especially if you seek help. There are a number of really worthwhile things that can come from getting through a severe depression or a bout of great difficulty. We typically learn to be more resilient. We get more of a sense of supports that are available if we need them. And it helps in mobilising those supports to get a different perspective on things. Often we come through it being a little less harsh on ourselves or rigid in our expectations. There are many things that can be gained from going through difficult times.